Hi, blessings to everyone. I'm coming here to share my husband's story of COVID, and I want to just encourage people to become patient, to be patient advocates during this time for your loved ones. And I want to share some of this journey to hopefully encourage you guys with some lessons learned. First of all, it is only by the Lord's strength that my husband came out alive during this time. He was hospitalized for 5 days and just came in from the hospital literally at 10:30 last night. So I would like to share a little bit of timeline of what exactly happened. So first of all, he started getting some symptoms of just being very tired and all of that. On a Tuesday, he started feeling tired, and then by Friday, he ended up with a fever. Then Saturday was kind of rough. Sunday, we were able to get an at-home COVID test, and he was actually going to go get the monoclonal test, but he wanted to get a COVID test first to not get like a false positive. So he went ahead and got an at-home COVID test on Sunday night, which was positive, and then he also, we were given an oxypulse meter to check his oxygen levels. Sure enough, his oxygen levels were very low, like at 90. So I encouraged him to go to a hospital. He went to a hospital, and the hospital did not really do much. They said, your levels aren't that bad. Your oxypulse meter is probably just off. And he sent him home without anything, without even a COVID test or anything. So that was Sunday. Monday, he goes and gets a COVID test because he has to for his job. We have to wait 2 days for that result. Tuesday night, again, his oxygen levels continued to not only stay the same, but kind of getting worse. There were times where it was at 88, even a time I remember at 85. It was very scary. So he goes, reluctantly, he thinks that his oxypulse is just wrong meter, which is what they told him. He goes back into, actually in urgent care, they transport him in an ambulance to a hospital. I'm not going to name names. And at that point, when they transport him, he's on 4 liters of oxygen automatically, and he's only at a 92. Remember, you're supposed to be over a 95 level of oxygen. So he gets into the hospital looks him over, and they discharge him, again, with no prescription of oxygen, nothing. So at this time, he's super low on oxygen. That night was really scary. The next day, he ended up going to get the monoclonal because he was able to secure a positive test of COVID. So Wednesday, he went to get the monoclonal, even while he's on low oxygen levels. So then, fast forward, he tries to go to the hospital Sunday, discharge. Tuesday, discharge. Friday, we get a phone call that he had some abnormal blood results, that he had an infection in his blood, and he gets septic, and he had to come into the emergency room automatically. So we go to the emergency room. It's Friday at 5 p.m., and they immediately put him on 10 liters of oxygen. 10 liters of oxygen. This has been a week where he was actually needing oxygen, but we couldn't get into a doctor's office with COVID. Nobody was accepting him, and the hospitals kept discharging him until he's at a level of really bad place, right? I mean, we're now in a life and death situation of oxygen levels that he's at. So that's Friday night. Thankfully, the blood results the next day were a false positive. Apparently, the nurse said there's a lot of lab errors there. Kind of weird. And then I have a whole story about trying to get an advance directive at the hospital. They had a hard time getting it to me, and they said they didn't have it, and I had to push and finally get one to sign that they need to make decisions with me for this life-threatening situation. But that's another thing I had to fight. And speak with the manager about the next week. But anyways, so then he gets in. I'm not allowed to go back there once he's admitted. Friday night, I can't see my husband. Friday night, Saturday, Sunday, Monday, Tuesday, and then finally on Wednesday, since I'm out of quarantine, since I live with him, I'm able to see him. So during those 4 days, initially, I was on the phone constantly with his care team. They were trying to push a lot of experimental drugs like remdesivir and starts with a T, tilazuzab or something, that don't show any positive results and a lot of risk. We told the doctor, called my husband over the phone to his hospital bed while I was on the phone with my husband. The doctor, I asked later, the nurse said that the doctor's not seeing the patients right now. They're just calling them on the phone. They're not even giving them a physical evaluation. But while he was on the phone with the infectious disease doctor, he told them no to remdesivir. And he agreed, because he said, Alex was already on day 12 of COVID, so the viral load wasn't much to risk getting this experimental drug. And then he pushed for the other one that starts with a T. But then they didn't stop asking, right? So every nurse that came on every shift, every 12 hours, what about remdesivir? What about remdesivir? Another doctor comes that he has to see, what about remdesivir? So he keeps denying this. There's just a lot of things that they did in their protocol that's very much cookie cutter approach, that they don't look at the person as an individual. And I just want to encourage you to stay on top of being a good steward to your own body or those to your loved ones, as God wants us to, as patient advocates, okay? Because the protocol it's just they don't think outside the box. And I asked them, my husband's getting a steroid, so supposedly his sugars are spiking. It causes that, apparently. They give everybody they prescribe insulin to, and they give it to them. But I asked them, but what's the level? So after speaking with the doctor later, he agreed, the nurse agreed, but I had to speak with the doctor, and the doctor agreed. We came up with agreement. Okay, if he's not over 200 level, he doesn't need the insulin every single time. And he agreed to that, so there was some things he agreed with, some things he wouldn't, I wanted him to be on some high dose vitamins. They rejected that. It doesn't happen. This doesn't happen here. It's not standard. My husband's not standard, guys. We're not made to be standard and fit into a formula. So anyways, I'm so thankful after 5 days in the hospital. Honestly, my husband needed oxygen. That's what he needed. Above all, he already had the steroid prescribed to him. They gave him antibiotics. They tried to push a bunch of other drugs to him. What he needed was oxygen, way ahead of time. So anyways, we finally got him home last night. They gave him discharge early, but by the time the oxygen took hours to get to him, and then once it got there, just getting it to his room took another couple of hours. So we finally got him home to us at 10:30 last night, and we're so thankful. But I just want to share our story of how to just keep pushing for your loved ones. Rights to good care. It's not the nurse's fault or the doctor's. We know that they're working in a very tough system that is overrun. Yes, it is, but the protocol is also part of the problem. And we need to just be advocates for our people. And I pray for all those who have lost loved ones during this time. I know the stress and all of this it's really a lot, but God is still good, and He still sits on His throne. And I thank you so much for your support and prayers, and continue to keep, the good rest and vitamins and active lifestyle. And only God has control of these situations, but we can control certain things, like being a good advocate for our loved ones. So I encourage you guys. Love you. Bye.